There will always be a need to transport biological material from one place to another. This could be within a single laboratory, between laboratories in the same facility, or between facilities in different locations. Safe methods and procedures must be in place to prevent any release and risk of infection to the individuals transporting the materials, or anyone else the materials might come into contact with. Within the laboratory, samples will often need to be transported as part of normal working practices. For example, moving frozen cultures from the freezer to the bench, or culture vessels from a biological safety cabinet to an incubator. It is important to have agreed procedures in place to minimize the likelihood of release or exposure. All vessels containing biological agents should be clearly labelled with at least the contents and date. You should not label agar plates on their lids. If the plates are dropped and the lids come off, you will not be able to identify the samples left in the bases. Label agar plates on the underside. Now, if the plates are dropped, you will still be able to identify them. Make sure lids are secure prior to transfer. As an extra precaution, lids can be sealed with an adhesive film. Plastic should be used, where possible, to avoid a sharps hazard in case of breakage. Purpose-made racks should be used to transport bottles, tubes or agar plates safely. Moving items using a tray will help to keep them secure and contain any spillage. When transporting higher hazard biological agents, it may be preferable to place tube racks, flasks or plates in plastic boxes fitted with lockdown lids. The boxes should contain absorbent material in case of a spill. An additional layer of containment could be added where necessary. For example, items could be placed in sealable plastic bags along with absorbent material before being put into the container. Note that the outer containers should also be clearly labelled with at least the contents and date. Spill kits should be available for use in the event of a spill during transport, and laboratory personnel must be trained in their use. Samples often need to be transported between locations within the same building. For example, from where they are received and booked into the system, to the laboratory where they will be processed, or from a work area to a separate storage room, or between laboratories for different types of processing, for example, from microbiology to biochemistry. Waste may also need to be transported from where it is generated to a different location for decontamination, or to a separate storage area. If samples are being transported in boxes with lockable lids, the outside of the box should be clearly labelled and surface decontaminated before it leaves the laboratory. There should be prior communication with the intended recipient of the materials when transferring between departments, so that the recipient is aware that they will be receiving the materials. Lack of communication can lead to confusing situations and wasted effort. Where many or large samples are being transported at the same time, you should use a trolley. Items should be stacked neatly and ideally on one level. Trolleys which are overloaded or badly organised are more difficult to handle and give rise to a much greater risk of items falling off or spilling. A trolley with side panels or wire baskets will provide more security for larger loads. Transferring biological agents between locations in the same building must be planned, organised and carried out in a way that minimises transit through communal areas and public thoroughfares. Samples may need to be transported between buildings on the same site. All the precautions we've seen so far will apply, but further consideration should be given to the layers of packaging needed to minimise the risk of leakage in transit. This could mean more layers of packaging with enough absorbent material between layers to absorb the full volume of infectious material if it were to leak. Some plastic packaging designed for specific containers has absorbent material bonded to its inner surface, which can hold the full volume of liquid in the container. It's recommended that the outermost transport container is rigid and impervious, so that it can be easily decontaminated. This could be a locking plastic storage box, as we've seen previously, or a larger item such as a cool box. The package should be clearly labelled with the sender, the recipient and the package contents. The recipient must be notified in advance of the transfer.
Hey, I've got your environmental sample.
Personnel involved in the transfer must be suitably trained on any risks presented by the transfer and how to safely reduce those risks. Samples may be transported between facilities in different parts of the country or between countries using postal or courier services. In these cases, you must follow the UN International Model Regulations on the transport of infectious substances. These regulations govern how these samples are packaged and labelled, depending on the biological material being transported, and give guidance on suitable packaging methods. For transport purposes, biological agents are classified into 3 groups. Category A infectious substances are capable of causing permanent disability, life-threatening or fatal disease in humans or animals. The regulations contain an indicative list of Category A pathogens, but others not on the list may meet the Category A criteria. Category A substances affecting humans and animals are covered by UN 2814. Category A solid medical waste is covered by UN 3549. Category A substances affecting animals only are covered by UN 2900. Category B infectious substances are capable of causing infection in susceptible humans or animals, but do not meet the criteria for inclusion in Category A. Category B infectious substances are covered by UN 3373. Category B clinical or medical wastes are covered by UN 3291. Samples in the exempt category are those for which there is a minimal likelihood that live biological agents are present, or environmental samples not considered to be a significant hazard to health, or biological agents that are considered to be non-pathogenic to animals and humans. The UN regulations also define packaging systems which use packaging materials capable of containing and adequately absorbing the full volume of any leakage, should the primary containment be breached. A triple packaging system is recommended for all 3 classifications of infectious substances, and is required by the UN regulations for many of them. The primary receptacle containing the biological agent must be watertight, leak-proof and clearly labelled. The primary receptacle must be wrapped in enough absorbent material to absorb all fluid in case of a breakage or leakage. The secondary packaging contains the primary receptacle and must also be watertight and leak-proof. The secondary packaging may contain several primary receptacles along with absorbent material. It should be noted that there are volume and weight limits for packaged infectious substances, and these should be checked before the final package is made up. The secondary packaging must be surface decontaminated before it is placed in the outer packaging. The third layer, known as the outer packaging, is used to protect the secondary packaging from physical damage while in transit. The outer packaging is also used to display various information, including the contents, the shipper and recipient information, UN certification marks, hazard symbols, and orientation arrows. Documentation that describes the contents, the identity of the shipper and recipient, and any other details required by the UN model regulations must be provided between the second and outer layers of packaging. For Category A substances, the secondary and outer layers should be rigid, while for Category B, these layers may be non-rigid, such as plastic bags and envelopes. You should check through the regulations carefully to make sure you are using the right materials. It's important to stress that as well as the right packaging material, the correct information is included with the package, so that the contents, shipper and recipient can be identified in case the package is damaged, mislaid, or delivered to the wrong address. In summary, good practice for the transport of biological agents includes clear labelling on the outer surfaces of containers or packaging. Where possible, use containers made of plastic rather than glass. Minimise the likelihood of spills by using racks, trays, lidded containers and trolleys. Use absorbent material between layers to absorb spills. Surface decontaminate outer containers. Have spill kits easily available. Avoid transit through communal areas. Make sure staff are adequately trained and understand the need for clear communication. Follow national and UN model regulations and use the triple packaging system where required.